Yes, Dr. Sabah.
Yes, we can start.
Start if you're ready.
So, yeah, I'm Dr. Sabah. Good morning.
Good morning,
And
Doctor.
I'm Dr. Sabah, and I'm the Senior House Officer in the Rheumatology Clinic today.
Yes,
May I
Doctor.
confirm, are you Mr. Ahmad
Yes, Doctor. I am Ahmed.
and you're 70-year-old?
Yes, Doctor.
Nice to meet you, Mr. Ahmad.
Thank you, Doctor. Thank you.
We are here to discuss more about your recent complaints. Uh,
Yes.
so, may I know how far do you understand about your condition?
I have been suffering pain and stiffness in my shoulders, Doctor, and neck since 4 weeks. My GP gave me some medication and local gel also, but really I didn't improve. Last week I came here and I met the consultant who requested some blood test and told me to come after.
Voice is not clear, sir.
Yeah? Yeah.
Voice is
Yes, خلاص, okay. And last week I came here and met the consultant who requested some blood test and told me to come after a few days to get the result and start treatment. Really, doctor, I'm suffering a lot.
Mm-hmm. I'm really sorry to hear about what you've been going through for the past few weeks.
Yeah.
And uh, so, as you rightly said, we have the results of your tests,
Yes.
and your symptoms and your tests suggest that you suffer from a condition called as polymyalgia rheumatica.
What called, doctor?
It's called polymyalgia rheumatica. Let me
Yeah.
explain what exactly it is.
Yeah, doctor,
Uh,
please.
it's a condition which typically occurs in after the age of 50 years,
Yeah.
and when your defense mechanism starts acting against certain tissues of your body, such as in your case, it's against your muscles, your
Yeah.
shoulder, your neck, your spine, and you experience this pain and this stiffness, especially in the morning. Uh, so, mm, however, the good news is that we have your condition responds very well to treatment.
But doctor, is it serious disease?
Mhm. So I would like to inform you that polymyalgia rheumatica, fortunately, is not a serious disease at all.
Yeah, it's good.
Apart from the symptoms which make you so distressed, it doesn't affect your length of life or
Yeah.
doesn't cause any serious complications.
Yeah, it's
However,
good. Yeah.
sometimes it may be associated with another condition, which I will tell you. We'll speak about it in a bit later. Okay.
Yeah, please, doctor, yes.
So the medication that we want to start for your condition is a steroid called prednisolone.
Oh, steroid.
Yes, I'm afraid so. But the best thing about uh, starting steroid in your case is we're going to start it on a very low dose
Yeah.
and uh, on a very low dose. It's just 15 milligram per day. And I do understand that okay. So when we start steroid, you'll see a dramatic response to therapy.
But
Your
doctor,
pain.
I know that steroid is dangerous medication, really, doctor. I know many people develop fracture because taking steroids.
Mhm. I empathize with how you feel, and I understand and appreciate your concern. But what I want to tell you is that this steroid is a very low dose steroid, and it does have side effects. Okay.
So with low doses, no side effects, doctor?
No,
Yeah, it's good.
in
It's
your
good.
no, you will have side effects.
Ah,
Uh,
I should. Oh, I will
yes,
have side effects with low dose also.
yes, there is a chance. There's always a possibility of side effects because in your case, we would be giving steroid for a long term. It might extend for a period of 18 months to 2 years to completely resolve your disease. Mhm.
So will be curable, doctor, with this treatment? Will be completely curable, doctor, with this treatment?
Uh, so, as you rightly asked this question, Mr. Ahmed, your condition is not completely curable,
Yeah.
but we can treat it, and your symptoms may completely resolve, and you may just feel as if you don't have the disease at all. Mhm. And if we really complete the course, most patients have complete resolution of symptoms. Sometimes they may have a reoccurrence, but which is not very often. Mhm.
But doctor, as I told you that I know some people develop a fracture because taking steroids.
Mhm.
So what you will do for me to also to avoid this side effects?
Yes, Mr. Ahmed. Uh, your concern is very valid. What I would like to tell you is steroid, or when taken over a long period of time, is
Yeah,
known to affect bones and
yeah,
cause thinning of the bones. And that does make them vulnerable to fracture. Mhm. So
yes,
what we're going to do is we're going to start you on some calcium and some vitamin D3 supplements to strengthen
yes,
your bone along with the steroid and to minimize the effect on the bones. Along with that, what we do is we're going to follow you up for any symptoms. So I want you to be aware anytime you have a back pain, which typically increases with movement, does not allow
yes.
you to sleep at night, you need to come back to us. However, even before, uh, or you have pain on any other part of your body, you need to alert or
But
inform
because
us.
doctor, already I have back pain. Already I have back pain when I'm walking or climbing stairs. Already I have back pain.
Yes. Uh, now, so where is your back pain exactly located right now?
Lower part, doctor.
Hmm. So what we're going to do is we're going to do a DEXA scan now for you
Oh,
before we start this therapy. So DEXA scan is a scan which is going to check how strong or how weak your bones are. Okay, it's going to measure the strength
yeah.
of your bone. And then, depending upon the result, we may start you on some bone strengthening medications to really avoid any steroid effect on your bones to a great extent.
Yes, doctor, yes.
Mhm. And I will also involve a bone specialist, and he will guide us further about once we have the results of your scan.
So
Uh,
the bone specialist will see me, doctor, also.
uh, yes, since you have this back pain and
Yeah,
we need to start you on this medication, we
yeah,
will involve him now and we will make sure that we have a proper idea about what exactly is your situation
yeah.
and what best is the way for you to follow.
Okay, doctor. Okay.
So, Mr. Ahmed, uh, uh, did I answer? Was I able to answer your concern?
Yes, doctor. That about the disease, you mean, doctor?
Yes,
Yeah,
you were
please,
most
doctor. Yeah, told me,
okay.
doctor.
Okay. So, Mr. Ahmed, along with the effect on bones, steroid does have some other side effect also. Do you suffer from any high blood pressure or high blood sugar at all?
Yes, yes, doctor. I have diabetes.
Okay. And is it controlled?
Yeah,
Because
very well. Yeah, doctor. It's very well controlled.
okay. Sometimes these steroids can cause rise in blood sugar, rise
Oh,
in blood pressure, and but we're going to follow up your sugars more often now since
oh
you're on
my God.
steroid. Mhm. And I'm sorry about how you feel, but I want to assure you that's a very low dose, and most likely we will not face great
So,
difficulty.
doctor, this steroids will improve me with this pain, and but really, doctor, I feel that this will increase my blood sugar, and I need more medication for this reason. My blood sugar now is very controlled, doctor. I afraid that become uncontrolled after initiation of this medication. So, please, doctor, if you have another options, I feel that it will be better, doctor.
So, I really understand how you feel
Yeah.
about this medication at the moment. But Mr. Ahmad, this is the best medication for your condition, and it will really resolve your symptoms completely.
So, what about blood sugar, doctor?
Yes, so I'm going to involve a dietitian along the way,
Yeah.
and also your diabetologist will be on board, so we know how how your blood sugar we're able to manage your blood sugar.
So you mean, doctor, you will add some medication to control blood sugar if my blood sugar become high?
Uh, Depends. I mean, we may have to increase the dose
Yeah.
of what medication you are taking, and sometimes we may have to add another medication as well.
Yeah.
But that will really depend upon after we monitor your blood sugars and we see how your blood sugar results are.
Okay, doctor. Okay.
Mhm. Uh, Sometimes I want you to be aware about all the side effects so that you don't have questions as to what exactly is happening to you. Sometimes it may cause this burning in your tummy, uh, burning in the upper part of your tummy.
Yeah.
So initially, we're going to monitor you. If you have any of those symptoms, then we may have to start you on another medication to prevent this burning in your tummy.
Yes.
And yeah, and as I already informed you, we might have to take it for a little longer time to for a complete resolution of symptoms. Mr. Ahmed, there's one thing that I would want you to be aware is that sometimes there's a condition called as giant cell arthritis, which may accompany your condition. Okay,
Yeah.
and in which you may have some headaches on the sides of your head, and you may have uh, difficulty in pain while chewing, and that and that's a serious condition in which sometimes patients have sudden visual loss. So
Mm.
I just want you to be aware of this condition. In case you experience these symptoms, you can report to us immediately.
So, doctor, how much possible to develop this other disease?
Mhm. So the chances of coexistence of these two diseases is a very low percentage, maybe 10 to
Ah,
15 percent.
yeah, it's
Mhm.
nice.
Yeah, yeah. But uh, but it is my duty for you to be aware, to make you aware about all the
Yes.
possibilities.
So, doctor, this steroids will not prevent the development of this other disease?
Uh, it will prevent, your low dose steroid will prevent, and the treatment for both the condition is same. It's just the
Yeah.
dose of steroid that is different.
Yeah.
So
But it will
it's
not prevent it to come, doctor?
uh, I'm sorry, I do not have the exact answer to this question.
Yeah.
And I will definitely have a word with my consultant and get back
Two,
to
2 minutes,
you.
doctor. Yeah,
Okay.
doctor. But when
So,
when 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 can this disease develop? If will develop, when will develop this disease, doctor?
the other disease you mentioned.
Yeah, 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 doctor. Other disease.
Okay. Yeah, you're right. Because it can occur any point of time. The similar presentation, like after 50 years of age. Mhm.
Yeah,
So,
anytime can do.
yeah, we're going to monitor you. If you have any of the symptoms, please do get back to us.
Yeah.
So, Mr. Ahmad, I would also, since you have this back pain, I would like to know, are you able to manage your daily activities at home?
Yes, doctor. Before, yes, but really since that time I have this pain and stiffness. Really, I found difficulties to manage myself and manage my wife also because she has a stroke.
So do you, okay, I understand that it's hard for you. So, do you think you would uh, be happy to receive any help to this end?
Yeah, yes, doctor. Really, if you
Okay,
can
sure.
help me, really, I will be appreciate, doctor.
So we have a social worker
Yeah.
and the team, and we will put you forward to them, and they can guide you. Let's see how they can help you with it. Do you smoke, Mr. Ahmad?
Yes, doctor. I'm smoking.
And do you drink alcohol?
No, doctor, not drinking.
Okay. So, Mr. Ahmed, I would advise you to consider quitting smoking. And if you need that help, we can refer you to the smoking cessation clinic. So, just to summarize the discussion that we had, Mr. Ahmed,
Yeah.
we've
Yes, doctor.
discussed about your condition called polymyalgia rheumatica. We'll
Yes.
be starting on medication called steroid
Yes.
on a low dose, 50 milligram of prednisolone, and we're going to follow up with uh, for any of the side effects. We're going to involve a bone doctor for your back pain at the moment and the dietitian along with the diabetologist, and we're going to monitor you for any of these side effects. Uh, is there any other concern that you have for me?
Thank you, Dr. Sabah. Time off.
Okay.
Great, Dr. Sabah. Really great. Uh, First of all, uh, when you suspect that the patient will develop giant cell arthritis,
Because patient will have headache.
yeah, when you suspect that patient with polymyalgia rheumatica will develop giant cell arthritis.
Sorry, I don't know.
Yeah, so this is also important question. Really, giant cell arthritis sometimes can be on the same time, at the same time, or sometimes can be earlier or later than. Nobody, only you can mention for the patient. There is no specific time that can be this disease developed, but the patient with the polymyalgia rheumatica have the risk to develop this other condition. The
Mm-hmm.
other question he told you, I think he asked you, this dose, will this medication, will it prevent this giant cell arthritis to develop in the future? This I think you
Yeah,
don't.
yeah. I didn't have the answer to this question. Yes.
Yeah, yeah. Really, it may prevent, not necessary to prevent.
Okay.
It may decrease the possibility to develop giant cell. Really, I read two references. One reference told that can decrease the possibility for giant cell arthritis to develop, and the other reference told no, not affect the possibility that can also the giant cell arthritis to develop even with this dose of steroids. So you can mention for the patient to be in the middle side. You can tell him that the medication can or may decrease the possibility for this disease, giant cell arthritis, to develop. The other questions here. Uh,
Dr. Ahmed, also he asked me what is the percentage of patients. So,
Yeah, yes, you answer me right. Yes, you are answer me right
okay.
about as you mentioned. Usually, it's 2 person in every 10 person, and it means 10 to 20%. So you answer me 15% the possibility to develop this disease, and this is the correct answer. So 10
Hmm.
to 20%. So
Okay.
the important answer here, in spite of the numbers, that low percentage of people can develop this disease. So the majority of people will not develop this other disease. Okay? So low percentage will of people can develop this other disease. This is the best answer to be if you forget the numbers.
Yeah. Okay.
The side effects, doctor, side effects. Usually we know that corticosteroids has many side effects, not only this we mentioned, but what's the important side effect should be mentioned in the exam, or also should be mentioned for any patient in our real life, because it's considered serious side effects, and the patient can develop these side effects anytime and should be aware for these side effects. You mentioned for me osteoporosis or thinning of the bone, and you mentioned for me what else? High blood sugar, high blood
Diabetes.
pressure. What
Hmm.
else also? And you mentioned for me stomach irritation. What else also? You should mention
Yeah.
this. Should be
Weight
mentioned
gain,
others. Weight,
obesity,
weight gain should be mentioned, and what else?
easy
Cataract.
bruising,
Cataract. هلا
cataract. He's old, yes.
easy bruising, not necessary to mention. Why? Because easy bruising, if you forget to mention, it's not serious side effects. Okay, if
Hmm.
anything in future. But really, cataract, it's serious side effect. The patient should be aware about it, because the patient should decide to take this medication or no according to side effect you explain for him. Because
Hmm.
now, if you tell the patient, Doctor, Mr. Ahmad, that this medication can cause a clouding of your lenses, what's called cataract. So maybe the patient refused to take this medication because this is he afraid from this side effects and like this. So,
Hmm.
what the important side effect should be mentioned for any patient when talk with him about prednisolone, as you mentioned for me, osteoporosis, weight gain, high blood sugar and blood pressure, and cataract, and also you can mention increased risk of infections. Other side effects, yes, it's if you remember it, it's important, like psychosis or psychiatric manifestations, yes. But really, this is side effect the most important to mention for any people, also in our real life, to be aware for this side effect. Okay, and when always you talk about side effects before to I also advise our candidate, this is really when you talk with any patient about side effect of medication or about complication of procedure, before to start to explain or to mention it, I advise for all, first of all, to mention why we need to treat this disease. You tell patient that, as I told you, the disease can also cause significant implication on your life, because this stiffness and also, as we mentioned for you, increase the possibility of the other complication like depression. For this reason, we need to start the treatment for you. And The benefits that can gain again from this medication or from this procedure, believe me that overweight. Okay. دكتورة سبا,
Yes, doctor.
sound from you. There's some. So, always mention 2 points. That the benefit from this medication, why the patient should take this medication, and then mention for the patient that the benefit that will gain from this medication or from this procedure overweight the complication that can occur or it's rare to occur with this medication. Before to start to explain complication, before if you start directly to tell the patient this medication can increase the possibility of infection or this medication can increase weight, already the patient will be upset from when you mention directly for him like this. So the patient will hear this first of all. So maybe the patient will argue with you and tell you that no need to start medication. But when you tell the patient that the complication or side effect from this medication or from this procedure, it's rare in comparison with the benefit that will gain from this medication. So the patient will hear, let the patient initially hear this one, that the benefit that overweight the side effects that usually rare or less. After that, you can mention side effects when you talk this. Okay. And you forget something very important, Dr. Saba. Really, you forget something important for steroids. This really, I have many candidates talking about steroids. Only one candidate with me remember this information. And this is the most important information for steroids. And all of us, when in real life, apply this is recommendation. The most important thing for steroids that to tell the patient don't stop steroids suddenly. Don't stop steroids suddenly. This is a very important issue for steroid. Why? Because you tell the patient, because once your body is used to steroids, if you stop the tablet suddenly, you may develop serious withdrawal effect within a few days. So this is very important when talk with any patient with the steroids. You should tell them this one. So you should not stop steroids suddenly without advice. You should not stop steroids suddenly without advice, because if you stop steroids suddenly, you may develop serious withdrawal effects within a few days. This is very important thing. This scenario is very important. Why? Because many candidates forget to talk with the patient about giant cell arthritis. And really be sure that this scenario, they brought this scenario in examination not only to talk about polymyalgia rheumatica or steroids. You should talk about giant cell arthritis, and not only superficially or briefly. No, you should mention it clearly. Why? Because to increase the patient awareness for this disease, when the patient should seek medical advice urgently, when the patient develops the symptoms. So not enough only to talk about polymyalgia rheumatica, you should also talk about giant cell arthritis. So first of all, start with the patient. Dr. Saba, I have a question for you. You need to break bad news for this patient. This scenario is the scenario of breaking bad news or no?
No.
Yes, very nice. You are good. So this scenario, because many candidates also break bad news because tell in their self that this patient can develop, so this disease can sometimes develop giant cell arthritis, so I should break bad news. No, no need to break bad news in this scenario, because the patient has now simple disease, not serious disease, and also this disease also can be managed very well with medication, and the possibility the patient to develop giant cell arthritis is only, as we mentioned, 10 to 20%. So no need to break bad news. This is only explain about the disease. First of all, write in your paper before to go exam, for any disease, when you explain any disease, put these points to talk about it for the patient. First of all, what's the disease, definition of the disease, then the symptoms, then the complication, then the outlook of this disease is curable, controllable, or this disease will deteriorate more, or there's no treatment, or is progressive. Outlooks of the disease, what's the treatment for this disease, and if there's any precautions. Like in this disease, we have some precautions, like if you can tell the patient when you have headache, when you have difficulty to talk or to eat, you have pain in your joint when talking or eating, or when you have any blurred vision, so you should seek medical advice urgently. So precautions. So you should take about symptoms, complication. What the complication of polymyalgia rheumatica? Complication that this disease can cause, first of all, disability. The patient has really significant disability. Patient with the polymyalgia rheumatica have really significant disability sometimes to do daily activities. And the other complication, depression. Depression, polymyalgia rheumatica also associated with depression. And the third thing that giant cell arthritis. Really, giant cell arthritis is not complication. This is not complication. It is very important. Giant cell arthritis, not complication, but it's a related condition. So you can mention for the patient. So some patient with polymyalgia rheumatica also can develop sometimes related condition called giant cell arthritis. The complication of giant cell arthritis, not only blurred vision or loss of vision. And this is the common mistake also, especially when the scenario in station 4 about only giant cell arthritis. So the complication of giant cell arthritis, only the candidate mentioned loss of vision, not only loss of vision, because it's
Stroke, yeah.
Yeah,
Stroke
stroke
or
also. Yeah,
yeah, or
it's stroke.
even any artery blockage.
Yeah,
Yeah.
it's
Inflammatory
arthritis.
process.
Yeah, yes, you are right, Dr. Hassan. Giant cell arthritis is arthritis. It's not only temporal, like previous name temporal, or it's still named like this because the most common art that affect with disease is temporal artery, but really also can affect the other artery. But less possibility to affect the other arteries. So you should tell the patient that some patient with polymyalgia rheumatica also develop a related condition called giant cell arthritis and or temporal arthritis. So you can mention for the patient this can occur at the same time or sometime earlier or later than. What the symptoms, as we mentioned, this is disease can be serious and cause loss of vision, and also rarely other blood vessel also can be affected, like this going into the brain and cause stroke. Treatment, we talk everything about treatment. As we mentioned, precautions for the patient for disease. If you develop headache, if you have any pain in your jaw when you are talking or eating, if you have any blurred vision, so you should seek urgent medical advice. And the other thing for steroids also, we have for steroid, precaution for steroid, the very important precaution for steroid, that you should not stop the medication suddenly. This is the most important thing for steroid. This is everything about this scenario. This is common scenario in exam. This scenario is very common in exam to talk about polymyalgia rheumatica and steroid. Last question for Dr. Asiba. Steroid-induced osteoporosis. Which dose of steroids that can cause steroid-induced osteoporosis?
So even low dose steroid when
Yeah,
taken
which dose? Because this is examiner question. This is examiner questions always. Because why? Because if the patient, because many times you mention for me now in scenario that this low dose. So low dose also can cause osteoporosis and other side effects, especially if taking daily. So what's usually the dose of steroids that can cause?
7.5 milligrams,
Yeah,
is it?
7.5, and for duration?
More than 3 months.
Very nice. This is the answer. So this is the answer of steroid.
Osteoporosis, yes.
Osteoporosis. So 7.5 milligram for more than 3 months. This is the important questions, and you should all of you should be aware for this answer. Okay, this is so today we're talking about how can explain any disease for patient here in this scenario there is one hidden agenda, but you should mention because the patient should be aware for this disease if he develop in the future, because there's 10 to 20 percent possibility to develop this disease. And today we discuss how can also talk with the patient about steroids, and steroid very important. And please, I have one point also, last point.
Yes.
It's in this scenario, it's mentioned that your consultant decide to start prednisolone. Some candidate not mentioned for the patient steroids. Tell him that prednisolone. This is big mistake. You should tell him that steroid. Why steroid? Because we know that most people, most population know what the meaning of steroid, but nobody know what the meaning of prednisolone. Yeah, like in Arabic language, when you tell the patient cortisone, I will give you cortisone. All people know what the meaning of cortisone. So they will start to talk with you that, doctor, this dangerous medication, I would not take it. But if you tell anyone, I will give you prednisolone, so he will consider it as any medication. So please, this very important point. Don't tell prednisolone. You can't mention prednisolone, but you should tell the patient that this is steroid. This is very
Yes.
important point.
Yes.
Thank you, Dr. Siba. You are very great, really.
So, Dr. Hassan, sorry, one question.
Yeah.
So, when I said I will involve a bone doctor, he said, "Oh,
Yeah.
you're going to involve a
Yes.
bone doctor." Okay.
So for this reason, I ask you a question. You good. You get my point. Why I ask you this question? In your real life, you will
Yeah.
involve bone doctor for observation the patient, or you are the one you will observe him.
Okay.
So
But
you
he
are the
has
one.
active bone pain right
Yeah,
now. He has backache.
this patient has back pain. Why I tell you this back pain? Because this is, you should know that this mechanical pain, that the precautions, not only back pain. Yeah, I mean, because you told me when you have back pain, you should seek medical advice, because this is, you suspect that this is osteoporosis. So the question here, that for osteoporosis, that we are the one, always, we are the one will do regular follow-up and examination for you to know if you have any side effect from this medication. You understand this point, doctor? Because
Yeah.
back pain, especially low back pain, we know that osteoporosis usually affect the thoracic spine, so will cause mid-thoracic spine pain, usually, but can affect all spine, but usually affect the thoracic spine. So this is not enough to tell the patient, if you have pain, this is mean that you have osteoporosis. No, you should tell him that we are the one will pick this early by regular follow-up and regular investigation for you, and also will provide you some medication that can delay or prevent the development of the bone thinning. You understand me, doctor?
Yes, Dr. Hassan. So I said I will do the DEXA scan first and then
Yeah,
start.
yes, you are right. This is not wrong. This is good answer. Especially that this patient, 70 years, and you will
Yes.
start for him steroid. So this is one indication also to do, because maybe this, especially if female. So this is important
Yeah.
to know if she has osteoporosis before to start. There are many clinics do a DEXA scan before to start steroids. Really, I know many clinics also there. I
Yeah.
think one guidelines for patient above 65 or like this, you should know before to start for them that they have osteoporosis or no. This because will change the prophylactic treatment. Maybe the patient need to give
Bisphosphonates.
yeah,
Alendronate, yes.
yeah, androgen before to start. Thank you, Dr. Sabah. You are great. Only remember when you talk about, with patient about prednisolone, to tell him don't stop the medication suddenly.
Yes.
Excuse me, sir, I
Thank you
have
so
a
much, Dr.
question.
Hassan.
Excuse
One minute,
Stop the sliding.
1 minute, 1 minute, because there's
Hello?
After
sound.
15 minutes, we'll be
1 minute, 1 minute.
discontinued. Stop the
I have
sliding.
a question, sir.
Yeah.
I have a question.
Yeah, please. First question, doctor. Who is the doctor? I mute yourself, please, doctor, because I mute you. Yes, doctor.
Excuse me, I have a question. There it comprises of two things. First is you asked the question that is this disease serious? I want to
Yeah.
have a good answer for that. Another
Yeah.
question is that as the lead doctor, she told that this is a very low dose, but we
Yeah.
have to continue for more than
Yeah.
more than 3 months. What
Yeah.
should be the answer that it is not a, is it although it is a dose that is not, that can be serious because it is a for long
Yeah.
term
Yeah. Yeah. You are
use.
right.
What should be our optimal answer for this?
Yeah.
For these two,
First of all, prednisolone 50 milligram daily. Yes, it's low dose, but this not mean has no side effects due to this medication. We mentioned now that the patient taking 7.5 milligram daily for more than 3 months has the risk to develop osteoporosis, and also 15 milligram of steroids will increase blood sugar in patient with diabetes mellitus, and also 15 milligram of steroids can cause also cataract when used for long time. So this low dose, yes, it's right, low dose, but he has side effect of this low dose. When usually steroids will not cause side effects, when you give a patient 5 milligram daily, or sometimes you give him 5 milligram every other day. So that time, this means that will not cause serious side effects usually. But really 15 milligram of steroids daily, it's low dose, but it has side effects. But not like 60 milligram daily. You see, doctor, there is the difference. 60 milligram daily of steroids will have more side effects. So here you can answer the patient, you can tell the patient easily that yes, we are start low dose of steroids, that usually the side effects will be less, not completely or not absolutely no side effects. Yes, we'll start low dose of steroids, that usually the side effects with this dose will be less. You can mention this, but there is side effects, and you should explain the side effects. Here, this question, Doctor. The other scenario, when you are talking with the patient about nasal steroids or about inhaler steroids, that time you should not mention any side effects like this, thinning bone or obesity or like this, because that dose will not cause side effects. But here, steroids in 15 milligram will cause serious side effects, and you should mention all. About serious disease, yes, it's not serious disease in the meaning of serious, but really it's serious disease, this one, because we know that patients with polymyalgia rheumatica have increased the risk of depression, has an increased risk of disability. They cannot do anything in their life, and really this will cause serious side effects for them. Anyone, he cannot walk, or he cannot change his cross, or he cannot elevate his hands above. This is serious, really it's serious. This is disability. Disability, you know that why depression disease, sorry, there's many diseases are serious only because they cause disability, like chronic fatigue syndrome. Chronic fatigue syndrome can restrict the patient on the bed, and this can cause infection, increase the possibility of infection, increase the possibility of DVT because the patient cannot walk. So any disease, it's considered serious, but the severity of the disease is different from one to other. So when the patient tell you, is it serious disease, you can mention for him, as I mentioned for you, this disease can cause so significant disability, and also can occur, can cause also disturbance of mood. So this disease, if not treated well, can be sometimes cause serious complication, or serious or significant implication in your life. So it's not serious, but it's cause significant implication in your life, and sometimes can associate with other disease, other condition that one serious. Dr. Salah, please. Dr. Salah, what's your question?
Uh, yes, Dr. Hassan. Please, I have one question. Sometimes there is some cases, either non-steroid responder, despite it is rare, but it's also a possibility. And also sometimes the side effects of corticosteroid cannot be controlled. Is it appropriate in this situation to discuss in the first meeting with the patient that there is also another option, like steroid-sparing agents like methotrexate or azathioprine? We can need to use this medication on one day.
Yeah. Really, doctor, we told before, station 4, you should follow the scenario that mentioned by, written by the examiner. Here, the examiner decide to give this patient prednisolone. So the examiner before examine the patient and know everything about this patient. So when he take this decision, so this decision taken by best interest of the patient, and no need to discuss anything else. Only your consultant later will discuss with the patient about medication like azathioprine, methotrexate. You should not mention here at all, because not mentioned in the scenario. If the patient tells you, is there any other option, this is the best option for him now, prednisolone. Okay? So in the station 4, but in station 5 or station 2, yes, you can mention for the patient that we can give you steroid sparing medication, yes, no problem. But in stage 4, you should follow the scenario
Thank you.
completely.
Dr. Hassan,
Dr. Hassan,
you told that steroids should not be stopped at once. This has a serious consequences. Can you explain what will be the serious consequences if stopped earlier at once?
What serious, doctor? You know it? What's adrenal insufficiency?
Adrenal insufficiency.
Yeah, because can cause, as we know, that steroids cause inhibition of production of steroids from adrenal gland. So when you stop steroids directly, while to our adrenal gland resume to secrete the steroids, so this in this period the patient will cause adrenal crisis. So this is very dangerous for the patient, and this is what our aim. Okay, other question? Last question, please, because we should go to the next case.
Dr.
Last,
Hassan, one question about the
yeah,
tapering. When we should taper, with which dose, and how
yeah.
to taper? I mean, yeah, with
Use,
every patient we will taper, or only with
yeah.
7.5 and above?
Yes, you should. You know, when you use steroids, up to 3 weeks, no need to tapering later on. Up to 3 weeks, any dose of steroids, you can. You have
Sure,
two
thank you.
options, either to taper or not taper. 15
Sure.
milligram daily for more than 3 weeks should tapering like 60 milligrams. Same. You should tapering it.
Okay, sure, thank you.
Okay, we can go to
Doctor
next
Hassan,
case.
just one last question I want to
Yeah.
ask. Like it says that it is curable in within 3 years in most of the patients. So if the
Yeah.
patient says, is it curable? What should we say?
Yeah. Yes, for polymyalgia rheumatica, usually most patients need to take the medication for 2 years, and really many patients have no relapses before. But here you can mention for the patient clearly that, polymyalgia rheumatica, usually the medication need to be taken for 2 years. Yeah, but many people need to take this treatment for several years and sometimes for life. This is very important. So, for polymyalgia rheumatica, the treatment usually for 2 years, but many people need to treatment for several years more, and sometimes for life. And some patients, when stop steroids after 2 years, they will develop other relapse, other symptoms, what's called relapse. So we'll resume the medication later on. So nobody can suspect when the duration of the disease. Many patients, usually most patients, respond to this treatment and can stop medication within 2 years or after 2 years. But some patients may need longer time, and many patients has relapse after stop this medication, so need to resume the medication. This is our answer, doctor.
Hello, Assalamu alaikum.
Yes, Dr. Abdullah, you are ready?
Doctor,
Oh my God.
what about asking history in station 4? She asked a
No.
patient about
Station not
diabetes and hypertension, which is related to the steroid.
Yeah. Yes, doctor. In station 4, not allowed to ask any question related to the clinical data. No, and it's clearly in the examination written in the paper, not allowed to ask anything related to data. But for previous medical, 1 minute, والله, because there is some sounds. 1 minute, doctor, I will answer you. Yeah. I will repeat. In station 4, it's written clearly in the examination paper. Don't take any history data. Not allowed for you to ask about any disease before. This is not allowed for you. Only you can ask about social history. You should ask about social history. But in this scenario, the patient already, when you tell him that this medication will sometimes can increase blood sugar if the patient has, like you can tell him like this: this medication can cause raised blood sugar when the patient have diabetes, or sometimes for some people can also cause diabetes if they have tendency to develop diabetes mellitus. Here the patient will tell you, but doctor, I have diabetes mellitus. So here you can manage his concern, because they learn the patient. If the candidate tell you that this medication can raise blood sugar or can cause diabetes mellitus, tell him that you have diabetes mellitus. So no need to ask here any data according to the clinical history. Only you can ask social history: smoking, alcohol, illicit drug, And sometimes only if the patient has Hockham disease or like has family disease, and the patient told you, no, nobody in my family have disease. Here you can ask about his family. Yes, no problem in that time. Because the patient tell you, nobody in my family have the disease. So you should know if anybody in his family expired early. For this reason, the patient don't know whether his family affected with the disease or no. But really, in station 4, avoid to ask about any clinical data. So we can go to the next case, please.
Last question, doctor, please.
Yeah.
Okay. When we start, when we think to start to decrease the dose of steroid in polymyalgia rheumatic, when the doctor start to think to decrease the dose.
Usually, doctor will continue with the same dose up to at least 2 years. The patient will improve within days. We know that in polymyalgia rheumatica, usually the patient improve within days, within 1 week. But when you should think about to stop this medication after 2 years, that time you, as a doctor, you think to reduce the dose gradually and stop it. If the patient relapsed after that, you can resume the medication.
Okay. Okay. Thank you.
Thank you. Dr. Abdullah, you are ready?
Yes, I'm ready, Dr. Hassan.
Yeah, this scenario, I will give you 2 minutes, doctor.
Okay.